Eldorado FFA Agriculture Issues Forum, and we'll be talking about food deserts today. My name is Jessica Allen.
I'm Nada Martinez.
And I'm Veronica Chivita.
So the first thing we'll be talking about today is the debates of food desert. So there are several different debates about food deserts, and the first one is that pesticides still make foods bad, even if the fresh foods are available. So the pesticides that are being put on and into the foods still make the foods harmful, even if they're present. The second debate is that food deserts don't exist. Some people believe that they can get fresh food even if it's far away. Either they can walk to a bus station or simply walk to the grocery store. And the last debate is that people will still go to fast food places if grocery stores are available. So even if there are grocery stores right next door, people will still go to fast food places because they don't have the energy or time to cook a meal.
Okay, so some facts about food deserts. About 29 million Americans live in rural or urban food deserts. Food retailers are discouraged from opening chains in low-income areas because of the high crime rates, transportation costs, and low return of investment. The main factors used to classify an area as a food desert is distance from nutritional food retailers, and there's also other factors that classify communities as food deserts. And about 58 out of the 258 counties in Texas are classified as food deserts by the FDA.
Okay, so what is a food desert? The USDA's definition of a food desert is when 1/3 of the population lives about a mile away from access to fresh food in an urban area. In a rural area, it's when they live about 10 miles away. Another factor is when an area meets a threshold for poverty, which are low-income areas and cannot afford this nutritious food.
So the available food, not only in food deserts but all over. The USDA found that 2.4 million households are more than a mile away from supermarkets and lack access to a vehicle to get there. Also, within cities, there are 3 times as many supermarkets in wealthier areas than poorer areas. And the physical distance between a grocery store and somebody's house causes people in food deserts to buy foods from convenience stores and corner stores, which stock mainly foods high in fats and sugars. Also, the problem increases in rural food deserts because closing the gap between their house and the grocery store is impossible on foot. What about Texas? So Texas has the largest grocery gap, which means that it has the lowest number of supermarkets per capita. There's an uneven distribution of grocery stores, which causes the low-income areas to be underserved. And the Food Trust found that Texas can support 589 more grocery stores than it does now. And so with the more supermarkets and the even distribution of grocery stores, then food deserts would not be as a severe problem as it is now.
Okay, urban versus rural. In urban communities, grocery stores are found in suburban areas, leaving inner-city communities without a major food supplier. And this gap is filled with fast food restaurants, which are high-calorie and fatty foods. Rural communities, the availability is the main issue. Young families move away along with the availability of nutritious food because the retailers have to increase the cost of food as demand gets smaller, and this ultimately lowers the quality of the food.
So the cost of food. Individuals may live close to a retailer that provides fresh food, but it may be more expensive, which adds an additional barrier in food deserts. For example, the total of 6 common grocery store items at a convenience store was at a discount food store was $10.38, and at a convenience store it was $16.33. So this shows that convenience stores, although they're more available, are more expensive. This helps prevent food deserts, but it still harms a person's health because they are unable to afford the fresh food. So fresh food is available, but it's not affordable.
Okay, so some health consequences of fresh food, junk food, is that junk food is more expensive than fresh food, and low-income individuals are more likely to buy that inexpensive fatty food than more expensive fresh fruits and vegetables, which are on a per-calorie basis. And in terms of health, rural residents report overall poorer health and more physical limitations. with 12% of them rating their health as fair or poor compared to 9% in urban residents. There are many convenience stores, such as the one in the picture, that advertise that they sell bread, milk, and soda, but like many similar to this one, they don't sell fresh foods. And there is more likely to be a place to go when it is replaced with the grocery store. I'm sorry. And there is a significant risk for type 2 diabetes with high blood pressure and heart disease, which can lead to cancer. And obesity cost Texas $9.5 billion in 2009, and this was because medical bills were being paid for.
Okay, so some solutions. These are some ways to solve the issue of food deserts. First, the community gardens, which replace fast food restaurants. The food trust, which promotes a healthy diet. And the mobile produce, which is easier access to fresh produce.
Okay, so community gardens improves the quality of life for people in the garden. It gives the people a sense of purpose, and it also helps young people be more involved in their community and keep them out of trouble. It provides a catalyst for neighborhood and community development. If you grow a community garden, it can lead to more buildings in the area and can lead to having more playgrounds for the children. It creates opportunity for recreation, exercise, therapy, and education. The people that help keep the community garden running will learn how to grow the vegetables and will also learn what to do with it, such as cooking. It stimulates social interaction. People from all ages, from young to old, will interact with the community garden. It encourages self-reliance. So if you learn how to grow these fresh foods, it'll teach you to maybe grow it at your own home, grow a smaller community garden, and it produces nutritious food. With the stuff that grows, it's cheaper and for the people around it, and it also gives you more health benefits.
So the Food Trust, not only does it promote health, but it has developed a comprehensive approach to improving food access, which combines nutritious education and increased availability of healthy, affordable foods. So an example of what the Food Trust has done is in North Philadelphia's East Germantown. So in that area, the closest grocery store was a 20-minute bus ride. And fast food places were all over that area, except for a few convenience stores, which had expensive, unhealthy fast food options. And also in East Germantown, almost 1 in 2 children were considered overweight or obese. And what the Food Trust did is they built a 50,000 square foot fresh grocer, and it improved the residents' lives significantly.
Okay, so the mobile produce. These are basically vans in many cities that contain fresh produce, and they drive around selling in city areas. And although they are not found in Texas or anywhere near the area, there are other events that bring fresh produce to the people.
So urban and rural. In urban areas, they encourage the state and local officials to create incentive programs to attract grocery stores to neglected areas. This is supported by the residents because they want fresh food in that area, and it also lowers the number of food deserts. In rural areas, they use innovative ownership models, such as having the community run the grocery store, to increase the number of stability in rural retailers. So the benefits of having a community-run grocery store is that it allows people to make certain decisions that impact their own lives. Also, neighbors learn the economics of opening a grocery store, which they can apply to other aspects of their life, and this supports local economies because it has the money recycling into the economy. And also, local grocery stores provides access to a variety of fresh foods, and it also provides jobs.
Okay, so the health benefits of fresh foods. There is community-level interventions that focus on getting healthy food to low-income areas through farmers markets, community gardens, or mobile carts. Fresh food is also more nutritious than processed foods because of the chemicals and add-ins that processed foods have. Fresh food give a person more energy because of the vitamins and minerals they contain. And the person's digestive system improves because of the fibers and enzymes that fresh foods provide.
Okay, so in conclusion, there are many different views on food deserts, but it is still a problem, and food deserts can be solved with solutions like community gardens or organizations like the Food Trust, and also there are many benefits that come from having fresh food available, like health benefits. Okay, so in our diagrams, we have a diagram, and this is a rural diagram, and as you can see, there's a convenience store which does not sell fresh foods at all. So what can help in the community is if it is replaced
by a grocery store, such as Walmart, that does contain fresh food. And also if you build a community garden, which will also provide fresh food to the community.
Alright, and then over here we have an urban diagram of it. So you see how there are a lot of fast food areas and also convenience stores. So if we can take out the fast food places, we can add a grocery store.
Community garden.
Oh, community garden. And then so they have access to fresh food and that they grow it themselves. And also if we can take out more of the fast food places, then we can add a grocery store.
And this would solve the issue of the food desert.